What comes into mind when you hear the name or the word stroke? Stroke is a very common medical condition in our setup. You may have a relative or you may know someone in the neighborhood who has ever suffered a stroke. So stroke is one of the major complications of uncontrolled hypertension, and today we shall be addressing the complications that normally come about from uncontrolled high blood pressure. And stroke being one of them, we shall be able to address it in today's topic. Welcome back, good people, to my YouTube channel. This is a channel where I discuss matters health. I'm Angoi Mangi, a clinician. Don't forget to kindly subscribe, like, and to share my video, as to give in your comments, in your inputs, or even your queries on the comment section. So stroke normally happens when part of the brain is not able to get adequate blood and oxygen supply, and this could be due to blockage of the arteries that normally supply the brain. This can be due to either blood clots or fatty deposits. So what happens is that when this particular part of the brain is not able to get blood and oxygen supply, can lead to death of the affected part of the brain. So once this particular part of the brain is not able to get adequate blood and oxygen supply, it can lead to death of the affected part of the brain, and this is one way in which a stroke can occur. Another way is by the fact that high blood pressure or even trauma to the brain, which could be due to an accident, can lead to bulging, bursting, or even tearing of the blood vessels that normally supply the brain. So once there is bursting of these blood vessels, there could be spillage of blood into the brain tissue, and this is another way in which one can get a stroke. Another complication is sexual dysfunction. So damage to the arteries that normally supply the penile tissue would mean that flow of blood to the penile tissue would be interfered with. This would definitely lead to an erectile dysfunction. So you may consider checking your blood pressure levels in case you're suffering from an erectile dysfunction. Something else is kidney failure. So uncontrolled hypertension is the second leading cause of kidney failure. This is because damage to the arteries that normally supply the kidneys as a result of uncontrolled high blood pressure would mean that supply of blood and oxygen to the kidneys will be interfered with, or the kidneys will not be able to adequately get blood as well as oxygen, and this would mean that the normal functioning of the kidneys will also be interfered with. And we know that the kidneys are responsible for excretion of waste products as well as excess fluids. So something else is a heart attack. So the muscles of the heart are normally supplied by arteries that we normally refer to as the coronary arteries. So if these arteries get blocked by either a blood clot or fatty deposits, it means that the muscles of the heart will not be able to adequately get enough blood as well as oxygen supply, and this would lead to damage of the heart as well as a heart attack. Something else is eye problems. High blood pressure can lead to damage of the arteries that normally supply the eyes, and this would lead to complications like bleeding in the eyes, or not being able to see clearly or to visualize clearly, that is blurred vision, and can also lead to blindness in case this issue is not addressed. We also have heart failure. So high blood pressure for a sustained period of time would mean that the heart has to work extra hard in order to meet the demands of the body, and it is in this working extra hard that you find that the walls of the heart may get stiffened or even thickened, or meaning that the heart will not be able to pump blood adequately in order to supply the other organs of the body. We also have something that we normally refer to as peripheral artery disease. High blood pressure can lead to something that we normally refer to as a plaque. So once this plaque is formed in the blood vessels, it would mean that this would eventually lead to death of the particular part of the lower limb. Remember, we say that whenever any body tissue is not able to get an adequate supply of blood and oxygen, it can lead to death of the particular tissue of the body. So similarly, once the lower limbs are not able to get, and this would lead to removal of the affected, this would lead to removal of the affected part of the limb or part of the leg, which is something that we normally refer to as amputation. I'm sure you may have seen someone who had their leg amputated or removed, or part of the leg amputated or removed. So uncontrolled hypertension is one of the causes of amputation. Other complications that normally come about from uncontrolled hypertension are memory loss and dementia. Thank you very much for watching my video. Don't forget to subscribe, to like, and to share. And also don't forget to watch out for the next video, whereby I'll be demonstrating on how to take a blood pressure correctly at the comfort of your home. Thank you very much, and bye bye.